My name is Dr. Constance Okeke. I am a glaucoma specialist and cataract surgeon. I work here at Virginia Eye Consultants. Glaucoma is a very daunting disease, especially when patients are so, everybody sees sight as the worst thing that they would want to get rid of or lose. When you tell them there are these options, and typically we start patients on medications first, and so one of the first questions that I get from patients is this something that I'm going to have to use for the rest of my life? And when they get that and it sinks in that they have something that is that chronic and they're going to have to be thinking about it, worrying about it for the rest of their life, that can be very heavy on the patient. One of the things that I love about Trabectome is that I feel that it's given me a lot of opportunity to take care of my patients without having to worry about them so much. Is that I can actually give hope to my patients. And that hope comes with being able to let them know that there is an opportunity that they have where there is potential for them to get a procedure done that can help them get off of their medications.
I'm retired from the Navy, 25 years. Currently work down at the Naval Base. I was Senior Chief Bosun's mate. Enjoy what I do, good career. About a year before I retired, I went to get an eye exam. He told me that I had glaucoma, so I didn't take it seriously. After so many eye exams, my vision was getting worse. So every year I kept having to spend money on glasses, contact lenses, and eye drops. And after a while I stopped, but I still didn't notice my vision being bad. When I finally went back for another exam, I was starting to notice that my vision was deteriorating. And I started really getting concerned. Because I didn't know exactly what to expect. When I first came here, the atmosphere of this place was very, very comfortable. Everybody explained to me exactly what was going to be going on, how long it was going to take. I had the cataract surgery for both my left and right eye. I had trabectome surgery as well. After the surgery, the drops is really not a concern anymore because it's not a part of your life like it used to be. The surgery overall was a good experience because by the time my surgery came up, I was comfortable with everything. It sneaks up on you because right away you don't really know that you have it, and because if you're diagnosed with it and you don't see anything, you kind of put it off, but it creeps up on you. My experience, if I had to do it all over again, I would have taken it a little more seriously when I was first diagnosed with it. I was taking drops 3 times a day. The drops are expensive. You have to take it in the morning when you're trying to get to work. Then you have to take it to work with you. If you get busy, you might forget. Then in the evening time, you have to take them again. If you forget, then after a while, it kind of gets frustrating. And then when you go for your follow-up exams with your doctor, he tells you that your pressure hasn't changed a whole lot, and then he tells you you're not taking your drops like you're supposed to. So it kind of interferes with your daily life schedule. I tell them to don't delay, to go ahead and get it. You'll see the benefits right away. Your quality of life will change. You'll be able to plan and schedule things more without having to be concerned about if you took drops. Did I take them this morning? Did I take them this afternoon? Do I need to take them again? So it really improves your quality of life. I would recommend get it, not delay.
The burden of the medications on patients is more than what we really see. We can say, oh, you're on 1 drop, oh, we have to add another drop, oh, you're on 3, just keep up with your drops and I'll see you in so many months. But the in-between of what happens to the patient on that level of the patient experience is a whole lot more than we really, I think, realize. from the irritation in the eyes, from the worrying about putting the drop in, to if they go on a trip and they miss it, wondering if they're going to go blind in those few days that they're away from their medications, all that worry, all that stress, all those things, like I said, this opportunity to be able to provide this to my patients allows me to give them hope that there are other options. And again, knowledge is power.